When it comes to psychiatric disorders, most people think of schizophrenia, depression, alcohol and drug dependencies, but few people realize how common anxiety disorders are, and amongst those, what we call social anxiety disorder. We're aware that only about half of the people who suffer social anxiety disorder seek help, so the condition is not widely recognized by the general public nor by the primary care professional sector. So what exactly is social anxiety disorder and what are the symptoms? Social anxiety disorder is an anxiety disorder that is classified as one of the phobic disorders, and it's characterized by the individual having an intense fear of being scrutinized by others and making a fool of him or herself and feeling tremendous embarrassment or shame. This inevitably happens in social situations, and so the individual would find it very difficult to speak in public, to make any comment or express an opinion, and accordingly avoid social situations, even smallish group situations. And as you can imagine, this can have very serious impact on that individual's capacity to function socially, to function in their occupation, and to get on with life generally. So it can be very compromising and very uncomfortable to live with. Now, what is the difference between ordinary shyness and social anxiety disorder? Shyness is a very commonly experienced difficulty that many children and adolescents experience but grow out of. Now, the similarity between shyness and social anxiety disorder is indeed that both of them have their onset in childhood or adolescence, and both of them occur mostly in people who are self-critical and who lack confidence and self-esteem. However, the difference is that only a small percentage of people who experience shyness in childhood and adolescence go on to have social anxiety disorder, and perhaps more importantly still, only about 50% of adults with social anxiety disorder report having suffered important shyness or debilitating shyness as a child or adolescent. In other words, a fair percentage of people develop the social anxiety disorder irrespective of whether they had shyness or not in childhood. There's also a fair amount of robust data to suggest that there's a genetic component in the development of social anxiety disorder, and so that makes it somewhat different to ordinary shyness. And furthermore still, there's no evidence that social anxiety disorder is closely linked to adverse events in childhood. So it seems to be an anxiety disorder with probably partially at least genetic origins that develops often, most often perhaps even, independent of shyness in childhood or adolescence. We're aware then that millions of people around the world suffer from social anxiety disorder, but do we know what causes it? We don't know for sure what causes it. I've already said that it's associated with personality prone to high self-criticism and a lack of self-esteem and confidence, and I've said that there's a genetic component too. There might also be contributors from some difficulties with social interaction in general in childhood, adolescence, or difficult experiences socially, but we're not absolutely certain of what other factors might be clear precipitators or predictors of social anxiety disorder. Once you've identified that your patient is suffering social anxiety disorder, what treatments are available? There are, broadly speaking, two treatment options for social anxiety disorder. Once it's established, it's unlikely to just fizzle out of its own accord, so active treatment is probably required. Now, the first of those treatment options is psychological therapy, and principally we use what's called cognitive behavioral therapy. And this therapy aims to provide education to the patient about his or her symptoms. It provides social skills training, it provides anxiety management techniques, and it also provides what we call cognitive restructuring, which helps the individual restructure the anxious thoughts and the fearful thoughts that they have about how they will be in public situations. And it also ensures that the individual goes out and practices these newly acquired techniques, what we call exposure treatment, in public situations, so that they can gain confidence that they can indeed function in ways that they didn't think they could, that they can overcome and manage their anxiety in social situations so that they can regain their life and regain a broad range of activities. Now, the second treatment option is drug treatment. Broadly, we aim to use SSRI drugs, which is the most commonly used group of antidepressant and anti-anxiety drugs available on the market at this time. And most of the SSRIs seem to work in social anxiety disorder. We tend to use the standard dose. There doesn't seem to be a dose-response curve, so higher doses probably aren't an advantage over the standard dose. And treatment should probably go on for about 12 months, which is significantly longer than we treat an episode of depression. But 12-month treatment period, and then tail off the drug and stop it. And the individual might well enjoy sustained benefits. It's a reasonable response to SSRI drugs, and they're well worth a try. Whether one chooses psychological therapy or drug therapy is really dependent on the patient's preference and what the doctor thinks might be most appropriate in the circumstance. But one of those treatments should probably be tried first rather than both of them tried together. If the first treatment option doesn't work well, the doctor can certainly go to the second treatment option, provided that seems to be appropriate and acceptable to the patient.